Okay, there are a lot of differences between the trucker convoys and the BLM riots of 2020, but one of the most striking is how the medical establishment is condemning the former despite embracing the latter.
Folks are really taking an informed and calculated risk and saying that in this case, I think the risk is worth it. And I can't say I disagree with them.
The good news and the thing that's on the side of the protesters is this is outdoors. And in some cases, people have taken the personal responsibility of wearing a mask.
What does this reveal? Joining me now is Dr. Jay Bhattacharya, Stanford Medical School professor, and Dr. Peter McCullough, cardiologist, epidemiologist based in Dallas. Dr. Bhattacharya, pretty emblematic, don't you think, of how politics infected public health? I mean, I'm laughing because it's so obvious what they did.
I mean, I think the right to protest is a fundamental right. I support both the right of the BLM protesters to protest as well as the truckers to protest. But I do think that it is very interesting that the medical establishment supported one versus the other. And it's not as if people don't notice. This has real consequences. If the right people on the right think that public health is not supporting their basic civil rights, they're going to distrust public health. And in fact, I think that's already happened and will have long-term negative consequences.
Dr. McCullough, you've been talking a lot about the public trust waning given the attacks on you. Obviously, the entire Great Barrington Declaration, all of you have just been trashed morning, noon, and night. You've turned out to be right about pretty much everything. But we still have people on television who are involved in the scaremongering. Dr. Leanna Wen today. Watch.
Lifting a government-imposed mask mandate doesn't mean that it's suddenly safe. It doesn't mean that people should go out and rip off their masks because COVID is gone. Now, I do think that there is a level of unfairness in this, in that life has now become less safe for those who are the most vulnerable. If they're now going to be surrounded by people who are maybe unvaccinated and also unmasked, they could be more exposed than before.
Dr. McCullough, will they ever drop this? Will they ever relent? Ever?
You know, Laura, the two Super Bowls were night and day. You remember last year it was in Tampa Bay, and they let in just a few vaccinated, uncertain healthcare workers. You know, this time it's in L.A. The stadium was packed. I noticed all the interviews afterwards. There was no masks, no cameras on 6-foot sticks. It's completely changed. The emergency phase of the pandemic is over. People know it, and it's time to move on.
And Dr. Bhattacharya, I was talking to one of our mutual friends the other day, and he said, by his calculation, he's a pretty good mathematician, we could be at like 94% seroprevalence. Explain what that means and why it could be significant.
When the disease first arrived, no one was immune. No one had any exposure to it, and it could cause severe disease. Now, what 94% seroprevalence means is that a very large fraction of the population is either recovered from COVID or it has some protection due to the vaccine. That means that it's no longer an immune-naive population. The disease is nowhere near as dangerous to the population as it once was, simply by dint of the fact that the population has protective immunity to it.
Dr. McCullough, Biden's former COVID advisor lamented what he thought was the backlash, not against people like you, but against the controllers. Watch.
We have two pandemics going on right now in this country. One's caused by COVID, and it surely is taking a heavy toll on us. The second one is a pandemic of loss of trust in government, in public health, and in some cases the media. And in all cases where we lose the trust of the people, to try to get them to comply with recommendations to help save their life and the life of their loved ones becomes very challenging when they don't believe you.
Well, yeah, but that begs the question, Dr. McCullough. It's challenging. Why? Why is it challenging to try to get them to believe you next time?
Once there's a series of committed statements and they turn out not to be true or misleading, trust is broken, and it's very difficult to repair. We should have always seen teams of doctors working in groups, coming to consensus. It's far safer than what happened over the course of the pandemic with our public health agencies and their communication plan.
Dr. Bhattacharya, should we ever have shut down this country at all?
I don't think I do not think a shutdown was ever justified. What was justified was focused protection of the vulnerable. We knew from the very earliest days of the epidemic that it was older people and certain other folks with chronic conditions that were really at high risk. We should have moved heaven and earth to protect them instead of closing schools, which did nothing to protect them and hurt our kids.
Gentlemen, thank you. Great to see you both tonight.